You're watching TV9 News and I'm Prajwal D'souza. We are currently in the second wave of COVID-19. Although the country is reporting a large spike in cases and a significant number of deaths, a large number of people are recovering from the deadly virus. However, some of these people are also known to face post-recovery complications. According to the US Centers for Disease Control and Prevention, some of the post-recovery complications include the bouts of long COVID, during which you might see tiredness, depression, cough, and difficulty in breathing, among others. Now, it is possible for some to even see a multi-organ effects. There are also reports of heart attacks and kidney problems triggered by COVID-19, which a person can face after recovering from the disease. During these times, it is important and crucial for the patients to have a good post-COVID-19 care. So what do you do? How do you look after someone who has recovered from COVID-19? Here is what immunologist Dr. Sitesh Roy suggests. Doctor, after a patient is recovered, what type of care is needed for them at home?
After a person recovers from COVID-19 infection, depending on the severity of the illness, whether it was mild, moderate, or severe, in most mild cases, people can require no special attention or focus other than gradually getting themselves back into their activity and daily routine with some observation for any delayed or what is called long COVID symptoms showing up. For someone with moderate infection who has required hospitalization, oxygen therapy, or any of these things, observation for any recurrence of symptoms, again, any long COVID symptoms, and most importantly, for any evidence for blood clotting or thromboembolic phenomenon is very, very important, as well as any cardiac related symptoms.
If someone has comorbidities, what should be done?
For anyone with comorbidities, it's very important that after they have recovered, they see their family physician or their specialist in order to identify whether it's their diabetes, their hypertension, their kidney disease, their heart problems, or any other chronic illness that they have, that those are continuing to be well managed, well controlled, and not causing any new issues that might have not been there before COVID. It is very important for people who have comorbidities to keep track of their health.
Should patients continue to monitor their health even after a complete recovery?
It is strongly recommended that even for people who have had mild infection, that they continue to monitor their health at least for 1 week before they get back to physical activity, exercise, and those who have had moderate or severe disease need even more monitoring, where they may have to monitor their pulse oximetry, their heart rate, their respiratory rate, maybe even their temperature, because we are seeing some complications where secondary bacterial infections or fungal infections are showing up in the weeks following recovery from moderate to severe COVID-19.
What do you suggest the family members do to look after a recovered patient?
The family members of someone who has recovered from a COVID-19 infection certainly needs to be there primarily for motivation and to give them the confidence to get back to their normal life, normal physical activity, exercise, recognizing that about a week of rest would be ideal, maybe even 2 weeks for those who have had hospital stays. And for people who have had severe infections, maybe a month is required before they can gradually and progressively, in a graded manner, do exercise, do physical activity, get back to routine days of daily living activities, and then into a more exercise regimen of walking and household activities so that they can be normal. So,
Doctor, what is the length of post-COVID care required for a patient? How long after recovery can they resume their normal life?
for mild cases, I would say in a week they can be fairly back to doing their daily routines. They may still have some fatigue, myalgia, muscle aches, etc., tiredness that may require a couple of weeks with gradual observation to resolve, and with ongoing physical activity. Those in moderate range, I would say about 2 weeks and beyond, they should be fairly out of any concerns, but with careful monitoring, they can get back to their normal life and recognize that they may still feel some breathlessness or shortness of breath, some tiredness, some fatigue, some muscle pains, aches, some lack of energy, which they will gradually need to work on and get back to normal. The ones in the severe case may even require physiotherapy and respiratory guidance and training to get back to their normal breathing.
It is important to take proper care of yourself even after you have completely recovered from COVID-19. For the lucky ones out there, it is not the time to let your guard down, and it is important to follow all the safety measures to stay safe. If you like this content, do give this video a big thumbs up and don't forget to subscribe to TV9 News on all the social media platforms. Thank you for watching and stay safe.